My name is Andre. I'm a general surgery registrar ST8, and my subspeciality is gastrointestinal surgery and surgery of childhood. I've done some ultrasound training previously, and I currently use it for difficult intravenous access. However, I was keen to increase my knowledge of point of care ultrasound scan, especially with abdominal scanning, to see how it might improve my practice or add to my current surgical practice. I think the most useful was the hands-on scanning time and having the instructors close by, so that we are able to kind of get real-time feedback with sort of how we're scanning and what we're finding whilst we're scanning. I think this course, especially the way it's targeted towards mainly surgical trainees, would be really beneficial. I think it's something that probably maybe is either if you're starting out in your surgical training, or maybe later on in your surgical training. However, I think you need to be in a department where you're going to have easy access to an ultrasound scan, so you're able to actually continue practicing once you've been on the course. I know, like in our hospital, we have some areas in the hospital where we're able to access ultrasounds. However, we don't always have one readily available on our wards. So I think maybe the more people that get trained, then obviously this will potentially change. Yes, I think I would recommend this course to someone who is interested in learning a bit more, or maybe considering taking up point of care ultrasound scan in their clinical practice.